Good afternoon, everyone. I'm presenting an evaluation of the Cash for Work program in Somalia that happened between 2023 and 2024. The Cash for Work was a USAID funded intervention, and we recently had data collection for the follow-up, and we're wrapping up the results. So what we're presenting here is like, we would be very grateful if you can discuss our controversial results. There's a lot of evidence that shows that social cash transfers improve food security and reduce poverty. In particular, we focus on public work programs, which is a type of conditional transfer. But there is very limited evidence in fragile humanitarian settings, and that's why the Cash for Work was particularly interesting as a project. So our study aims to provide three contributions. The first one is to generate evidence of public works in fragile settings. We also provide evidence of what happens in Somalia. We built on the limited but growing literature around it. And we study broader outcomes than are usually presented in the literature, such as social cohesion and psychological well-being. Our main findings is basically we see limited impact of the program. It has modest short-term effects after the intervention. We see positive impacts on social cohesion, on the social cohesion index, which we can delve a little bit more when I go into that section. We see positive effects on perceived resilience to droughts and floods, but no pests, but overall insignificant. On food security, we observe an unexpected negative effect, particularly a significant decline in dietary diversity. And this was one of the first results that we just were very disappointed to see. And then also in income diversification, we found an apparent decline in wage labor, likely due to baseline imbalances and the timing of the baseline survey as well. So the Cash for Work program in Somalia, it was implemented by FAO, funded by USAID, as I mentioned before. The timeline was between January and July 2023. They received 24 weeks of paid labor. The eligibility criteria to incorporate households was that they had able-bodied members in the household. They were compensated with 73 USD monthly, which roughly equates to 80% of the minimum expenditure basket. It had dual objective. On the one hand, to provide support by giving income to poor climate-affected rural households, and on the other hand, to restore communal infrastructure to enhance productivity and long-term development. So, I'm going to skip this. We expect several effects of the intervention by increasing social cohesion, by bringing people into the community and integrating them in labor-related activities that boost especially social cohesion in a conflict zone like Somalia, where most communities are ruled by clans. It's very interesting to see what happens when you have an intervention that may create a bridge, social capital that bridges sometimes clans, and I think that's probably one of the most interesting parts of this study. So our design was a longitudinal quasi-experimental study across 14 districts in Somalia, Somaliland, and Puntland. Our sampling strategy consisted of 4 treatment villages and 4 comparison villages per district. And we selected 15 households randomly per village. The targeted villages are rural villages with more than 20 kilometers further away from the district town, and not served by other humanitarian actors. The treatment group was done, the selection of the treated villages was done by the country office, by FAO country office. And we focus on households involved on the cash for work. We had conducted a propensity score matching study. We initially wanted to push for randomization, but Somalia is extremely complicated to bring even just the topic. And so you really have to rely on like local actors to give you just to set the implementation. It's one of the countries where really you need to, as an evaluator, you need to really follow with the constraints that you're facing in the implementation. And probably this is the message of our presentation here. So we have a summary index approach in the program evaluation. Like we basically, from many different questions, we put them together and we created an index which allowed us to eventually summarize some insights. And of course it's a black box, and then we discuss the components of each index. So the data collection happened at baseline in February 2023 with 1,697 interviews. And then the follow-up in March 2024, 56 treatment and 57 comparison. These are balance tests, so as you can see, like surprisingly, even without randomization or anything, we achieve like very interesting balance. Like we observe no differences between our treatment and comparison group in the main outcome that we're studying. So our methodology is basically using the inverse probability weighted regression adjustment. I'm not going to go into detail with that. And our main results are here. So these are like the indexes that we were studying. We're just discussing a significance level at 5% to be very conservative. And we don't see any effect in any of the major indicators except on social cohesion. Where actually it's a sizable effect of like 0.365 standard deviations. So what do we see of social cohesion moving? We see two things, the trust score and groups participation score. So basically the trust score was built on some set of questions which were being asked to community participants on things like, would you lend money to your neighbor? Would you accept that your neighbor participates in like working in your field and things like that? So we do observe like interesting effects there on the trust score and the group's participation score. So on resilience, we see increase in like self-perceived resilience to drought and floods. On food security, we see a decrease on household dietary diversity score. And basically the main kind of channel there affecting this indicator, which the funders were not very happy about, I think it was, our explanation is that once you start studying by item, by food item, what was exactly moving, we observed that they decrease the consumption of legumes and a diversity, like that decrease the diversity, but on the other hand, they increase the consumption of high protein food like dairy and meat, especially meat. You see an increased consumption of meat. So even though the household diversity score is going down, it would be interesting to go further and investigate whether this specialization is actually increasing the quality of the diet. And then impacts on income diversification. We observed a decrease in income sources and whether people were employed during the last year in wage labor, which was very shocking for us because that was the main purpose of the program, to employ people. So observing that the treatment villages are actually not employing people was very disappointing. But it basically happened because we were unlucky to begin the evaluation at a correct time. We started collecting data almost a month after the country office started like giving the support. So what we see is probably like they were already employed by the time of the baseline. Like we were not observing we were not being able to capture. This was very unlucky, and it had to do with like coordinating seriously with the country office, and we learned our lesson. And like we need to have like a constant person in the country office to communicate these decisions that are taken by the implementing partners, which sometimes are like very it just you need to coordinate a lot with them. And that's a potential explanation that we started too late and we were not capturing that. And also probably some like imbalances in particular variables that we observe also between our treatment and our control. And potentially another story is also attrition rate. We do see that our attrition rates are correlated to treatment status. Households in control group were more likely to have disappeared. But we, even though we have a 12% attrition rate, we conducted the test for bounds, and we observe like basically our results remain very much unchanged. So again, as a conclusion and reflection, like starting data collection at the RASH process is very important. Follow-up survey was conducted also 7 months after the program ended. So probably seeing effects on things like food security and some other variables that are going to be impacted in the short term, basically. And surveys should be taking place, the follow-up, sooner than that. Social cohesion, we have a clear positive impact, and probably by suggesting social capital, bonding social capital, bottom line, the cash for work may hold promise for improving social fabric in fragile settings, but better time evaluations are essential to detect material and psychological impacts. Thank you.